broadly, I listened to the president's briefing last night. I listened to part of it tonight. It's hard for me to watch because to me, what the country deeply wants to know, what's making people anxious is, do you have a plan? And where are we on the course of that plan? So what would you do if you were a normal president? Well, to me, you'd have three charts out there. The first chart is who's got the virus? What are the needs of every hospital in the country? And where are we as a federal government in meeting those needs, both for the patients in the hospital and the health providers? That would be sort of one chart. Second is, where is the virus growing and where is actually the curve flattening? That would be the sort of the second part of the briefing. And the third part would be how can we think about, as the governor of Rhode Island alluded to, getting people back to work? What would be required for that? What would be required is some kind of risk stratified approach that people like Dr. David Katz have talked about, where we massively test everybody. We know who we've got. We know who's got the disease, who's had it and is now immune. How do we risk stratify, phase them back into the workforce while we protect those who are the most immune compromised or the elderly, right, most likely to get the disease? So you'd kind of have three charts. Every night you'd come out and say, here's where we are, here's where we've fallen behind, here's where we're making progress. Instead, you have this president who comes out and just says, everything is great, it's all wonderful, we're just doing great, and anything that isn't wrong is President Obama's fault. And as a viewer, it makes me really enervated. It really makes me anxious. This is not helping.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.